Hello and welcome to How Would You Rate Your Pain? We will be exploring life, loss, love, and the power of resilience. I am Dr. Tiffany Bartell. Thank you for listening, and I can't wait to go on this journey with you. Hello and welcome to the very first episode of How Would You Rate Your Pain, the podcast that explores life, loss, love, and the power of resilience. I am Dr. Tiffany Bartell, a licensed therapist and your host. Today we will be talking about living with a chronic medical condition. Chronic disease is defined as a physical health condition lasting more than 1 year and causing functional limitations or requiring ongoing monitoring and treatment. It's estimated that 133 million Americans live with one or more chronic illnesses, and many of these chronic illnesses are invisible to others, but so impactful on the individual who has it. I do want to share a disclaimer that I am not a medical professional, and our guests today are sharing their understanding of their condition and their own experience with it. Here to talk to us today about living with a heart condition are two of my favorite people, Lou and Denny. Denny, tell us about yourself.
Okay, well, I'm a first year at Brooklyn College in New York, studying film, and actually, you're my mom.
Yes, I am. You're actually my oldest.
I am your oldest.
Yes.
I remember that.
Well, I remember it better than you do, but
That's
yes,
fair.
Yeah. Excellent. Thank you. So glad to have you here. And how about you, Lou?
Oh, hello, everyone. I'm so excited to be here. I'm Lou. I'm a social worker at heart. I love the creative arts. Oh, that rhymed as well. And like you said, I'm living with a chronic heart condition, but still finding joy in it, too.
I love that. Mm-hmm. Absolutely. So that might be a good place to start is maybe each of you can just share what your condition is from your understanding of it. Of course, doesn't have to be the medical dictionary definition. But Lou, what is your diagnosis?
Yes, so I have microvascular dysfunction or disease, but they like to go towards dysfunction, and it's what they consider unobstructed. So that means that the microvessels around my heart, instead of opening up when like my heart rate gets up, I'm exercising and things like that to allow oxygenated blood to flow in and out. Instead, they do the opposite. They want to like kind of shut down, spasm and such, and kind of shunt off that kind of oxygenated blood going in and out. But they call it unobstructed because it's not due to plaque in the arteries or anything like that. It's congenital. It kind of popped up out of nowhere, and it's one of those things that are still being researched because they're finding it pop up little by little. It's pretty hard to diagnose sometimes, but yeah, I have MVD, unobstructed.
Yeah, MVD. Okay. How about you, Deni? What's your diagnosis? Yeah.
I wrote this
It's
earlier.
a long name. You can use some notes.
Okay, so I have postural orthostatic tachycardia syndrome, and it's POTS for short, which is really tricky to Google because it comes up with pots and pans. POT, it's not what you're looking for, but basically it's a type of dysautonomia that affects your autonomic nervous system, which is your fight or flight. So it affects your entire body, and it kickstarts your adrenaline. And so out of the blue, your body's just telling you that you're in danger. So all those systems that you don't, need to run or survive, those shut down. So like your digestive system, your heart's racing, your muscles contract, and that can lead to a lot of like chronic pain and, stomach issues. And then that level of tachycardia can have other issues like dizziness and fainting. For a lot of people, like constant fainting, just like stand up, boop, tip over. And it can just really get in the way of things, kind of just passing out all over the place.
Mm-hmm. Yeah, absolutely. So if you, the way I think that it's been explained to us is that changes in posture are a lot of when people experience that tachycardia or racing heart. And I think, just being your mom and going, through this journey with you, on the sidelines, of course, you were the one in it. What kind of seemed to happen a lot when you'd have an episode is that like all of your autonomic systems would just kind of go on the fritz.
Yeah.
and all at the same time. And so that can be really scary. So you hit some of the symptoms, that dizziness and fainting. What other symptoms are common with POTS?
Well, I think I mentioned muscle fatigue, but also, a lot of headaches because your eyes dilate, and so it lets in a lot more light. And so if you're having an episode, you can get headaches from light and light sensitivity. Let's see, a lot of nausea, vomiting, shortness of breath. I think I mentioned them all.
Yeah. I think you did great. Yeah. So I think that the thing that surprised me the most with your condition was the GI issues.
Yeah.
It just seemed like your body would just
food,
not let anything come in and stay in.
Yeah.
And I think that could be really scary when your heart's racing at the same time and you feel like you're going to pass out, and then all of a sudden your stomach is not, being friendly. Yeah. Yeah, absolutely. How about you, Lou? What are some common symptoms or symptoms that you've experienced with your condition?
Funny enough, a lot of my symptoms are very similar to Deni's. We do have some places where we divert, but of course, like the dizziness, fatigue, especially if I do get my heart rate relatively high. So I'm going to say high for me. So high for me is like 135.
That is pretty high.
Yeah, but 135 is some people's like a light jog, maybe like a brisk walk or something.
Yeah.
So 135, that's when I start feeling a little bit of dizziness, chest pain, muscles clenching, especially like I would say my jaw, and then was it down my left arm? I'll start feeling some of that, muscle pain, headaches. I'm guessing because of the muscle pain, nausea, and if I do push it a little too much, that's when I'll start the onset of what feels like I'm gonna pass out. So we're talking about graying out of the vision.
Oh wow!
Kind of like that whooshing sound in the ear.
Blood rushing.
That's what that is.
I think that's what I heard.
Okay, thank you.
Blood rushing to your head. I don't know.
Thank you, because I've not actually passed out. I think there was one episode where I was at a meeting, and because sometimes high stress can also trigger some of those symptoms, but I was in a meeting and I guess like I zoned out and they thought I'd passed out, but I mean I was very much so. I never like fell out or anything like that. So I do remember those symptoms. So, and then heart palpitations. So I'll just get heart palpitations like through the day, maybe some spells of vertigo as well. But I would say similar to Deni, along with that shortness of breath, chest pain and such, just because my little ticker is just trying to work and really pump out more blood or just more oxygen. And so it doesn't want to.
Yeah.
So it causes a little bit of pain and a little tug of war.
Absolutely. Well, and it sounds like for both of you, these are symptoms that can just pop up during the day at times that's unexpected. It's not always like, something you're like, okay, if I do this, then I'm going to feel that way.
Right. And I know to expect it if I'm doing like physical activities, which part of my, introducing Lou, I love the creative arts. And one of those things is, dance and such. And so that I always have to monitor myself with that one. So I can kind of expect it, keep it at the back of my mind, like be careful, when you're approaching the yellow, and then when you are dangerously dancing, pun intended, in the red. But yeah, like you said, like during the day, there might be times where I'm just driving and I'll just get like
out of nowhere
a series of heart flutters or palpitation, or I might be in a meeting and the world just kind of tilts to the side, and that part is not as fun, just because you don't know why it happened, where it came from. So yeah, I would say that.
Yeah, absolutely. Do you feel comfortable if I share like my first experience with you?
Oh my goodness, yes.
Is that okay?
Yes, absolutely.
Yeah. So we were actually out, I think it was summertime, and we went to get ice cream. In the middle of the day, like two silly adult grown women.
Oh, we did a brunch first.
Did we eat first?
We did. We were adults.
Okay,
yeah,
okay,
we
good. Because I just remember the ice cream, and I'm like, why didn't we just get ice cream? But we ended up talking a lot longer than we had meant to outside, and I just kind of noticed you like melting a little bit and looking just a little bit not yourself. And thankfully, I've been around Deni enough, and I can kind of tell when someone's going to pass out. and I was so grateful that you were open and shared, what was going on with you, and we were able to kind of, revive you. But it was really interesting, like you said, just watching it from the outside in, it really can come on so quickly. And just kind of surprise you in the middle of a really relaxing day.
Oh, yeah, absolutely. I remember that day like just clear. And I remember before you'd said something, I remember feeling a little weird maybe 15, 20 minutes before. And at that time, I hadn't told Tiff that I had this condition because I tend to be pretty secretive about it. And maybe we'll get into that a little later in the podcast.
Yeah.
But I was kind of secretive about it. But then I don't know if you said... I think you said, like, Lou, are you okay? And that's when I kind of minimized it. I'm like, oh, I'm just feeling a little, like, lightheaded. Maybe I'm a little thirsty. And then out tumbled, I do have a little heart condition. And Tiff, you were like, are you potsy? Like, do you have... I'm like, no, I don't have potsy. And then from there, Mama Bear took over. My good friend popped in. She's like, yeah, we're going inside. We're getting water. And I think it was like maybe 5 minutes later, I was pretty much back to normal. Maybe a little zapped out, but back to normal. But like you said, I felt like inside, I'm like, oh, I'm going to pass out on my brunch date with my friend that doesn't know.
Well, and I should tell the listeners, I'm almost 5 feet tall. I'm just under 5 feet tall. And I like to think I'm very strong.
Yeah.
But my dear friend Lou, how tall are you, Lou?
I am 5'10" and a half, and that's when I don't wear heels, where I wear heels often. And I think that Sunday I was wearing a cute pair.
Yeah, you were.
So I was like in that 6'1" life, living.
Yeah. So I remember having this calculated thought of like, first of all, I recognize something's going on and I wonder what's, if she's okay and what I could do to help. The second thought was, I don't think I can carry this girl. Like, I'm going to have to drag her somewhere unless we can figure out what's going on while she's still like coherent and ambulatory. So that's maybe a good segue into my next question is, for both of you, and we'll start with you, Deni, when did you realize that there was something wrong? Because I think for both of you, this isn't something that you knew from a young age or was diagnosed at birth. So what was that journey like for you, Deni?
Well, I don't think it was on my radar, really. In middle school, I remember they had us doing like laps with like heart monitors on. And I remember it was always really, really easy for me to get my heart rate where they wanted it. I could just jog around and I'd be, in the red, and my friends would be like, that's not normal. And I'd be like, I'm fine. My face turning red and I'm like seeing spots, and it's like, no, this is good. This is easy. And then I would they'd be like, stand still. And I'd stand still and my heart rate would still stay up there. So my coach didn't know what to do with me. But I didn't start really thinking anything was wrong until I got this vaccine. Which one was it, Mommy?
I think it was your second meningococcal vaccination. Yeah.
Yeah, and after I got it, I remember feeling really funny. And then I got back to class and I got all these like heart palpitations, really, really, really dizzy. I actually started laughing hysterically, which was confusing to my friends. But yeah, and they were like, oh, it's an anxiety attack, it's a panic attack. And I was like, but I wasn't nervous about anything. I already had my shot. I was fine. And
we should mention that Deni does not like needles.
I really, really hate needles.
Oh my gosh, me too.
Okay.
Soul sisters.
Which makes you guys like really difficult patients. But continue. Continue on.
I mean, I hated needles before. Now I really hate them after that. But after that, the symptoms, they didn't really go away. I would just get these like heart palpitation spells just while I was sitting, or really dizzy. And after a while, you guys were like, okay, we're going to go to the doctor. And they're like, anxiety. It's anxiety. And you guys were like, it's not anxiety. And I was like, it doesn't feel like anxiety, but I mean, I'm no doctor. So but eventually we did get to the cardiologist and they were able to straighten it out. But it took...
it was a long road.
It was a long road.
Yeah, and I think it felt really long because it was in the middle of school and, being a high school student and all of that. I remember the scariest thing, two scary points, as a parent. One was you were playing in that jazz concert and you were playing the drums and you hadn't been feeling like yourself. So we actually had your drum teacher as a backup.
He's so great.
And I just was watching you play, and then all of a sudden you just kind of like went over to the side and just were like draped over one of the drums. And I think I had to kind of like partially carry you to the side. And I think the other really scary time was when we knew what you had. None of the medicine was working. Nothing was really helping. And we had to pull you out of school at that point. And I think you lost 20 pounds in 2 weeks. And just because you kept having these episodes, you couldn't keep food in. And we were basically just like carrying you around the house. And I think
I couldn't go to the bathroom.
That was really scary. Yeah.
We were just crying in a corner because I couldn't keep food in. Remember that time you guys came home and I was like, I can't eat anything. Yeah. So I think it was like a really condensed amount of time over probably your sophomore year where things just really popped up. Yeah.
How about you, Lou? When did you realize that something was wrong?
After listening to what Deni was saying, I'm wondering if I actually started feeling it when I was a little younger. But for sure, I would say 22. I was trying to, continue staying active and fit. And my friend was like, let's go exercise. And I do remember I wasn't able to really keep up as much, but I would just keep pushing. But I do remember distinctly, I was in grad school and she said, let's go for a run or a jog. P.S. Who likes running? Why? Why do we do these things?
Why?
But yeah, she said, let's go for a run. And I remember I couldn't make it past I want to say 50 paces, which I know sounds like an exaggeration, but I remember it was such a short period of time. And instantly I started feeling like, for the first time, chest pain. I couldn't breathe. I started feeling pain down my left arm. And then again, like the graying out of my vision. I remember I went back to my apartment and I laid down just to kind of recover. And I think I fell asleep. I just knocked out because I was so exhausted. And I was pretty tuckered out the rest of the day. During that year, the grad school and such, I remember several times trying to work out. That was during the time where P90X.
Oh my goodness, blast from the past.
I know I'm aging myself, but proud in my 30s, girl. But yeah, P90X had come out, and I was like, I'm gonna get ripped. Let's go. And no, it ripped me apart. But I tried I got maybe 5-10 minutes into the video, and again, my roommate came in. She's like, "Why are you on the floor?" And I'm just like, P90X tried to kill me.
Oh my God.
What I discovered was just
we are not slandering or defaming P90X or anybody who participates in it.
That is
for
true.
The record.
P90X is amazing. I have seen it yield amazing results. Hence
if you have a heart condition, maybe consult your physician before participating in any exercise program at all.
As a matter of fact, I think that is a disclaimer that's there. And then I listened to the disclaimer after I almost passed out. And that was what triggered it, because she found me home and I was just like, girl, I'm just out of shape. And eventually I did set up an appointment with my primary care physician in the area that I was attending grad school, referred me to a cardiologist who was just like, I think that this is just a little bit more than you being out of shape. You're young, you're healthy, something might be off. Now, mind you, they did throw out the anxiety word, which as we go through the this conversation, that will be part of the journey.
Well, it's not mutually exclusive, right?
It's not, right.
Yeah, when you feel like your whole body is on the fritz. It's very anxious.
They wanted to explore that as well. And I said, well, this doesn't feel like anxiety. But, they did say, keep in mind, you are in grad school. You are doing all of these things. You're, high achieving. You're like this runaway train. So it could be that too. So there was a little bit of minimizing that. I'm just out of shape and extremely stressed out. But I distinctly remember it was like 22 years old was when I was like, okay, something's not right here.
Yeah. So you kind of hit on it a little bit, Lou, but that process of diagnosing and like gave that diagnosis and getting treatment, what was that like for you?
Oh, okay. This is the part where it gets so emotional for me because it actually took over 10 years for me to get a diagnosis.
Wow.
And it was just a lot of advocating for myself and almost having to tell myself I'm not losing my mind. So after my cardiologist, actually he wasn't a cardiologist now that I think about it. I think he was just family medicine.
Gotcha.
After he proposed the idea that there might be something happening with the old ticker, I said, okay, consider that. But then I said, okay, let me get my first job, let me get established, and then we'll get going.
Later I'll have time to figure out why my heart doesn't work.
Exactly. Right now it's career time. Get the bag, as the people say. So I started career, and so when I moved across the country, that's when I started the journey officially. I would tell people, okay, these are my symptoms. And they said, well, let's do an EKG, which is just tracking the electrical activity. Of course, that showed up normal. Let's do an echo. And the echo did show that I did have some leaky valves, but nothing fully to explain the intensity of what I was feeling.
Yeah.
And so I did a couple of those and nothing. And then they finally had me do a stress test where, for the listeners, they pretty much hook you up to a bunch of wires, which hook up to something that's kind of watching your heart activity. And they put you on a treadmill and pretty much say, go for it, run. And run as fast as you can for as long as you can. I think they taper you in. Did I hit something? Okay. But they taper you in. And I remember, again, I wouldn't last long during the stress test. They would get the results back and say, everything is normal. Oh, yeah. You're just anxious.
Yeah.
And I was like, no, I know what anxiety is. Just finished studying it. I have actually lived with it. This is something different. This is only happening when
you exert yourself.
When I'm exerting myself. And so for years went through that. Took a pause, and then maybe 5-6 years into it, it was getting worse. I remember going to a doctor. He said the same exact thing about it being anxiety. And it was getting to a point where I was actually fibbing on my the application or the paperwork.
Yeah.
You had to go in. They would say, what are your listed conditions and stuff? And I would not put anxiety and or depression or any mental health thing on it because I figured, let me go ahead and isolate this solely to something being physical because I don't want them biased and immediately tossing it out, which, again, listeners, don't do that.
Yeah.
Please don't do that. But I was young. Yeah. And again, kind of working in secret because I didn't really want to tell my parents this was happening.
Oh, wow.
Either. Yeah. Just, I didn't want to worry them, especially because I was far from home. Eventually, I met this doctor. She was wonderful. She actually specialized and advocated for women in heart health. Oh, and I remember her telling me that oftentimes women's heart conditions tend to go undiagnosed big time because... sad to say, a lot of times people might say anxiety and such. And it's not solely to that, it's not exclusive to that, but that was our conversation when I kind of told her my journey. And long story short, several stress tests, an angiogram, which an angiogram is pretty much they put you under and they thread a kind of a catheter or a wire through, and they pretty much test to see the efficiency of your heart flow and such. So it goes through your major artery, your femoral artery. It is not fun. That angiogram didn't show anything. She said, worry not, we're going to do a more invasive one. Oh. They sent me to my other cardiologist in Stanford, and she was wonderful, and they did an angiogram that also simulated a stress test as well.
Oh, wow.
Yeah, so it was going to watch what the heart does, see the flow and everything like that, but then they were also going to mimic my heart racing like as if I was in a stress test.
I don't like that.
Oh, no, and I didn't either. So it was conscious sedation. So I was out, but I could wake up if needed. And I do remember at some point I woke up in the middle of the test and I felt like somebody was river dancing, Irish dancing on my chest, or hip hop, whatever it was. I just felt this major pressure. I felt so sick. And I remember telling my doctor, I'm like, I think I'm going to die. She's just like, no worries. It's just us. We're pumping up your heart. And I remember looking over and seeing my heart rate on the monitor it looked like 180 or something.
Wow.
And then she said, just hold on for a second, sweetie. I'm like, okay, doc. And then she said, we found it. We know what's going on. And I remember that was the last thing I heard before I said, so I'm not crazy. She's like, you're not crazy. And I think I woke up in the recovery room again.
Wow.
And
what a moment.
I know, as I'm saying this, like I'm feeling that emotion coming up again because like after 10 some odd years, somebody was finally validating that I wasn't losing my mind and something was wrong, and it wasn't associated with anxiety or anything like that. So that was my journey. I am still part of the research study because they're still trying to figure out, where is this coming from? Why is this popping up in young women at this time period? And so I'm just so grateful for the journey because it did teach me a lot. But that was my journey.
Wow, Lou, thank you so
good
much
night.
for sharing. I know I'm a little
goodness.
teary-eyed too. I think that, listening to you, I'm just struck with like how brave you had to be to get the answers, and how persistent. And sometimes the diagnosis comes from numbers on a chart, and sometimes it comes in a different way that's really scary, and we have to do brave things to advocate for ourselves sometimes in our health, and I'm just so proud of you for doing that, because you're definitely worth it, and you deserve those answers.
Oh, thank you.
Yeah,
I did bring my parents in finally after.
Okay.
Especially before the angiograms did, I finally revealed everything that had been happening. They were upset that I had it.
Fair.
So we worked that out. But it was very great to have them on the journey. My mom was a cardiac nurse after all, too.
Oh,
Okay.
wow.
Yeah.
But she, they were instrumental in kind of pushing that journey a little bit too.
Wow. Yeah. Oh, thank you for that. How about you, Deni? What do you remember of getting your diagnosis?
Oh, wow. We're going to go straight into that. Oh, wow. It's so hard to figure out where it started and then where it ended. I don't.
Yeah, so I think that, we were referred to a cardiologist.
I hated it. I hated it. It was horrible.
It was really interesting because, I remember that, Daddy took you to see your regular pediatrician.
Yeah.
Because you were still a minor at the time. And they said she needs to see a cardiologist immediately. And I think we got an appointment that week because they called, because we were like, oh, okay. Usually when you're referred to a specialist to get checked out, it's like, go make an appointment, whatever. And your pediatrician's office actually made the appointment with the cardiologist for us. And we're like, you're going to take her in right away.
Yeah, I don't remember any of that.
Yeah, you were really sick. And I don't know if you remember, you had to wear the heart monitor.
I do remember that. That
Yeah.
sucked.
It does.
I was going to ask, did you get it?
Oh my goodness, yeah.
How long did you have it for?
I had like 3 sessions with the Holter monitor, so 3
Okay.
sessions for 3
Okay.
nights.
Yeah.
Yeah.
Oh, okay. No, that was different. It was stuck to my chest, and then I just left.
Oh, like they inserted it in?
They did not. It was stuck.
Oh, yeah. I had that one, but
Yeah.
so I just had to self-administer it, but at 3 times for a couple of
No, nothing was
sessions.
administered. It was just a patch.
Yeah,
Yes.
I think you guys talk about the same thing.
Yes.
Yeah, so it's just the hookup to the monitor,
Yeah.
and then
Oh.
send it in.
Yeah.
Okay.
You did
okay.
3 rounds with it, and it sounds
Yeah,
like, and we did 1, and that's actually how we got the diagnosis.
Nice.
Was
Nothing was wrong with the rhythm,
was-
so they were
yeah.
like,
yeah, but you did have a couple of episodes that they were able to record.
yeah, I hit the button.
Yeah, so they, the instructions for us was, to hit the button when you're feeling that, that feeling in that episode. And so they were able to link that and give us a diagnosis. We didn't find any medicines that were successful in helping. And so treatment was a little bit different.
Yeah, they like drink water, eat salt,
Yeah.
eat food, and I'm like, I'm trying.
Yeah, we needed a little bit more help
Yeah.
than that. I don't know how much you remember of
I remember
process?
a lot of appointments.
Yeah.
And they
Yeah.
wanted to do a what was the scan they wanted, the scan with they wanted to do that like
I don't remember exactly.
Sounds like an
I don't
echo.
remember exactly.
yeah, that's what it was.
Yeah,
They
an
wanted
echo.
to do an echocardiogram, and I was like, no.
Yeah.
Because at that point, I'd given up. I was like,
Yeah. And
Yeah.
you were really sick.
Yeah.
You were really sick.
I couldn't stay sitting up in appointments. I had to lay down. They were doing all those hookups to the EKG. They weren't finding anything,
Yeah.
but they were still doing them. And I was losing weight, and I had to stop going to school, and I couldn't see any of my friends, and I couldn't do anything.
Yeah.
That's why, like you mentioned, that jazz band concert, that was like my last ditch effort, because I was getting to play drum set for that piece, and that was like a huge deal to me. And so I'd finally gotten the position I wanted, and it was my year. And then through the song, I start feeling like, oh, wow, I'm going to pass out. And I'm like, nope, no, you're not. You can do this. And so I got to the point where I was laying down on one of the toms and then just holding my arm up to the side and hitting the cymbal to keep the beat. And my director's like looking over at me like, where did she go? And like my mom comes over, my drum teacher comes over. He's like, it's okay. Like I can take over. And I'm like, I got it. I'm fine.
Oh, good.
Yeah. So
We'll finish song.
I hear you on that, Will Finn. I remember being in an event, like a comp or something like that, and I was, in the middle of a performance, and I was like, I'm going to pass out. And then I said, I will not pass out. You have 45 seconds. Dig in.
right.
Yeah.
Like it's, I can do this. I will do this.
Yes.
White knuckle through it. But obviously that didn't work.
Not when your body doesn't
No.
want to participate in that. So what we ended up doing was there's a clinic in Texas. We ended up talking to a lot of people. We did a lot of research. You did a lot of research, Deni, even as a high school student.
I don't remember any of that.
Yeah, I think you were really, really sick. And so we ended up getting you treatment about, I think it was like 4 months treatment with a center that specifically treats POTS. And so, we have Vandy near where we are, and then there's the Mayo Clinic. But this place takes some of their difficult cases and had good reviews, and it was a lot of work.
It was hours.
Yeah.
Just spent in bed. Like we would have hour-long sessions where we would practice standing.
Yeah.
Oh,
Like
okay.
from a sitting position, you would get hooked up to these electrodes so you could see your heart rate and your breathing. So you'd have like a chest band on, and then you would stand up and then watch it and then sit back down, and you'd practice breathing specifically a certain way when you stood up. Like breathe out when you stand up, breathe in when you sit down. We would sit at a table and like kick our legs like we were in swim class, like flutter kicks, and see our heart rate. And it was all about trying to sync your heart rate back to your breath to get it to go down when you were exhaling.
So it was a lot of
cool.
biofeedback, a lot of nutritional things. So what would you each say was the hardest part about like your journey with your heart condition? Either the psychological side, emotional side, the physicality of it. What was the hardest part for you?
I was, checking my notes again. What did I say? I would say honestly, the journey to getting the diagnosis was the hardest part, just because it was so discouraging. And like Deni said earlier, there was one point where I was just like, no, I don't want another echo. I don't want another, $400 bill. I don't want another. No more. So the journey, so kind of pushing through and not being discouraged by that, and that just kind of overcoming that sense of hopelessness when another report would come back saying nothing's wrong with you. And I'm like, can you guys stop saying that, because something is wrong? Of course, things change, and again, with encouragement, I was able to get past that. But I would say, that was the hardest part. And then also the dealing with the secrecy of it. Once I did get diagnosed and people in my close circles knew, I didn't want people outside of it to know, just because in my brain, even though I know that it was irrational and that's not how it works, I did not want people to see it as a weakness or something that could be used against me.
Yeah.
Just because, you know, anxiety had been used against people like, oh, like if she makes this decision or if she has this response, it's not because of what's happening. It's because because of that thing. And so I was like, oh, no. I am not.
Again.
Especially because, I mean, I was in height of my career. I was in administration. You know, still am. Now that I'm a little older, now I'm just like, yeah, people live with this stuff and still can do like great things. But, you know, being in your 20s and stuff, dealing with it, I was like, oh, no. You guys will see me as the epitome of health, okay, and perfection. And so the secrecy, kind of working with it and dealing. So I think that would be the hardest thing, the diagnosis and the secrecy.
Absolutely. That makes a lot of sense. How about you, Deni?
I thought really hard about this one. It was a hard one to answer. I think there wasn't just, I can't pinpoint one hardest part just because I feel like, oh, the microphone fell. I feel like each part was a different kind of hard. Like, you know, the first finding out and it was like fresh and it was isolating and, you know, I didn't know what was going on. And then, you know, like you said, the hopelessness of just being like, it's never going to get fixed. And the reality that it never will get fixed because there is no cure and there is no way to make it go away. And then, you know, starting to get better once we started that treatment from Texas and building a little bit of a life around it and then starting to grow that. And I think at every step, I just feel like it feels unfamiliar because nothing is the same. As soon as I get used to being one way, it changes. And so it's like, okay, I'm better. And then you get a really bad episode and you're like, okay, so I'm really sick. And then the next day you might feel better or maybe the next week. And so it's like, you don't have any reference point. And so, you know, I don't have anything that's permanent.
Yeah.
Beautiful.
Well, and I think, you know, as a 19-year-old, there's so much of your life that's changing and not knowing from one day to the next, you know, how you're going to feel. Your classes change every semester. Your professors change, you know. That's a lot of flexibility and agility. I don't think I was that flexible and agile when I was starting college.
No.
And so that's a lot.
I don't know. I think it just is, it's just tricky to navigate.
Yeah.
So I would hope that it would get easier, but I kind of think that it's just going to be different challenges at different parts.
Yeah.
And then I'll just have
that's a really good way to put it.
Yeah, I think I'll just have to figure it out over and over and over again.
Well, and that's kind of the process of, you know, growing into adulthood, but also you have kind of some extra, you know, extraordinary challenges. So what do you both feel like has helped you to get where you are today with your condition? I think so many times when we're hearing people's stories, we really want to put a bow on it, right? We really want it. And then I was fine.
Right.
I did this one thing and it was super hard and then I lived happily ever after. But I think, you know, part of what we're talking about today is, you know, living with these things in our lives. And both of you, you know, have kind of, it sounds like, brought your condition alongside you. And that's really hard to accept it into your life. So what's helped you guys get to where you are today, which, like Deni said, will be different a year from now or 6 months from now, you know, whatever. But yeah, what do you think?
Yeah, I can definitely attest to that, especially like I feel like I've taken my little friend along with me during various stages, and it's true, it does change quite a bit. Time, grace, and self-compassion definitely,
I love that,
have been so helpful, because I think it ties into the question that you just asked before. What was the hardest part? Something Deni had said, and what has helped that acceptance, because I did realize that, and I did have a moment where I had to work through that, but I had to accept that I had a ceiling when it came to certain to certain things.
Some limitations.
And that one was hard to deal with, especially considering the things that absolutely bring me light and joy in my life. And so once I was able to, it forced me to start that process of acceptance sooner than later, especially because I'm like, dang, there's no cure for this. Like, and on top of that,
there's no bow.
And then they're still doing research. And so all I have is like whatever's online, including Reddit. Again, do not go to Reddit.
Don't go to Reddit.
Please don't.
Don't go to Reddit.
Don't do it. And so like that acceptance, but definitely as well as time, patience with medical professionals. I've had to really, and that was hard. A little bit of forgiveness in that area too, that self-compassion, and then also practicing that vulnerability that it is okay. Like you have a chronic condition. That's all right. As a matter of fact, I gifted myself last year the cutest medical alert bracelet ever.
I love
I said,
this.
because for years, my friends were just like, how will people know? I said, listen, when your time is up, your time is up. And I realized that's not good.
No.
It's not good.
No.
It's not. So got me a cute little one. So, but again, these are those small steps to helping in my journey.
Wait, is that it?
This is it. It's my little rose gold.
Okay, listeners, they are comparing medical alert bracelets right now.
Hers is so cute. But yeah, those were the steps I took in like that acceptance.
I love that.
Yeah.
Yeah, and I think it's difficult without a chronic condition to allow all parts of yourself to be seen and to be present, even if it's just when you're with yourself. And so, it's kind of even a little bit more challenging, with this. How about you, Deni? What do you think has helped you get to where you are today?
Wow. I think, it's going to sound cliche, but journaling, I journal a lot, and that a lot of times that helps me sort out how I'm feeling and what thoughts are true and what thoughts are not. Let's see. I think just remembering that I'm a whole person.
Yeah.
Because chronic illness, like any other, mental condition or physical, or anything that makes life a little bit harder, it feels like it's defining because it touches everything in your life, from your mental health to your physical health to your activities to how people see you. And so I think it helped to just find one thing that I could do. And for me, that was writing, because I had to be in bed so much. And that gave me a little bit of an out, like something that I could express myself through, so that I wasn't just one thing. Because I don't think I would have made it if I didn't have at least one thing that was mine, because nothing else was,
Yeah.
It gave you a little bit of control, it sounds like. I also think one way that I've watched you feel like you have more power and control is just through the research that you've done. Obviously, as you get older, you are consuming more and more of those type of things. But, I think that your vocabulary about your condition, and even just since I've known you, Lou, your vocabulary about your condition is really expanded just in the conversations that we've had. And so I think that's one thing I really admire about both of you is, if you know what's happening and you can name it. Sometimes you're at a point, it seems like with what I've experienced with the two of you, where you can kind of head it off at the pass. And then sometimes you just kind of like strap in and are there for the ride. But I'm really even impressed with the way that you both, haven't, just kind of like accepted it, with a fatalistic attitude of like, well, there's nothing I can do about it. And so I love that. So starting with you, Deni, if you could go back to your younger self, back in that part where you were still in the diagnosis, realizing something was wrong, and give like a word of wisdom or encouragement, what would that be?
I thought about this one, and I don't know that there's anything that I could say, because I wasn't ready to listen at that point.
Good point.
But I think just seeing that I'm still here and that I'm able to physically stand up.
Yeah.
I think I think that would be enough, because I just wanted to know that I was gonna make it through.
Mm-hmm. Yeah. How about you, Lou?
I actually wrote this one down because it was what I told myself. It was, girl, do not let anyone make you question what you are feeling. Do not give up. You know yourself.
I love that.
That came from actually when you just talked about that fatalistic, just like laying down. That actually came of that.
We need a moment sometimes. It's okay to take a moment.
Well, I had the monitor, the heart monitor strapped in, and again, nothing was reading. And I remember I told my friend, I'm done. Yeah. And so we went for a run up the hill because she was just like, oh, no, we're going to trigger this thing. Let's go. And so we went up and down the hill. And I honestly thought that I'm about to die on this side of the hill. And I just remember laying down in the grass on the ground. And for anyone who knows me, that is like almost my rock bottom. I'm not a germaphobe. I'm just very aware.
You're just very aware of
I don't do
germs.
nature, but I'm very aware. But I just lay there and I told her, I was like, I can't do this. Like maybe I am losing it. Maybe I'm making all of this up. And I remember she told me, she's like, you know yourself, get up. And I remember thinking, I do. I'm not going to give up on this one. And so that's what I would have told my younger self even before getting to that point in the journey, which was on the tail end of getting the diagnosis. Do not give up. Don't let anyone question yourself, because you know you.
Yeah. Oh, I love that. So for each of you, people who are listening, they may or may not have something that feels similar, but I think, we all experience certain emotions of like discouragement or challenges and difficulty and things that seem really overwhelming. So what do you hope that listeners walk away from hearing your story today?
For them to listen to their heart. Oh,
Ooh.
Figuratively and literally. But no, seriously, like listen to yourself. Stay attuned. Like oftentimes the message is there. Sometimes it needs sorting through. That's why it's great to have a trusted group of people in your life, and being able to again put those words to things that you're experiencing as well. But the first step to that, at least for me, was listening to what was happening inside and slowing down. Especially because you want life to continue happening, and it will, but maybe you might have to go about it a different way, and that's okay. And it's also okay to stop for a moment and reassess. So listen.
And you deserve it.
Exactly. So like listening, stopping when needed, slowing down is okay. But listening to yourself.
I love that. How about you, Deni?
I think maybe I would want the listeners to know that to see yourself as a person, which sounds, it sounds kind of simplistic, but I think that when you see yourself as a human being and not just in like have your view of yourself as like, oh yeah, and then I do this and I do that and I feel this way, and it's like view yourself as somebody that you know, like a friend, and think about the compassion that you would show them and how you see them and how they're not just one thing and they aren't allowed just one feeling. And so I think if you're able to remove yourself a little bit, it helps you be a little bit more compassionate to yourself and be like, yeah, I do deserve good things, because I would want that for somebody else. And yeah, I am kind of cool. Like, wow, that was hard and I did that. And let's try this thing, just like kind of remove yourself a little bit so that you can see the whole you.
Yeah, I think it's the hardest to be a good friend to yourself.
Yeah.
I think we're always kind of trying to figure that out. Well, thank you both for being here. Lou, I just love you so much. And you're just such a light. And I'm so grateful for you sharing this. Your story is, so precious. And I know that privacy is something that, something that you love. So I really value this. And I know what a privilege it is for you to share it in this space. And Deni, of course, I love you.
I love you too.
And I'm so proud of you. And
Thanks,
I'm so
Mommy.
proud of, everything that you've done with your life and how you're still living in a big way.
I'm trying.
Yeah, I mean, I think New York City's pretty big.
It doesn't get much bigger than New York.
Yeah, I'm pretty proud of you. So I also want to thank our listeners for joining us for this episode. I know that many of you are listening and resonating with the stories you heard today, or maybe your experience feels very different, but the emotions and difficulty feel familiar. I just want to encourage you to find spaces where your own story can be held and given the support and love it deserves. Be gentle with yourself, and I'll see you next time. Thanks for listening to How Would You Rate Your Pain? Please subscribe on your favorite listening platform so you never miss an episode. And if this show made you think of someone, please share it with them to help us grow. I'm your host, Dr. Tiffany Bartell. You can find me on Instagram at the_happy_therapist_. This show is not intended as medical advice and should not take the place of therapy or other mental health services. Please consult with your doctor or mental health provider about your own health. You deserve all the support. How Would You Rate Your Pain is co-produced by WaveLength Studios and Chattanooga Podcast Studios and is part of the Podnooga Network. Graphic design provided by Josh Wilhem at JW Creates and music by Michael Crosa. I'm Dr. Tiffany Bartell. Thanks again for listening. We'll see you next time right here on How Would You Rate Your Pain?